ECG Practice Test 2026 Electrocardiogram Certification Exam Questions and Answers EKG Medical Guide. Question 1. What does the P wave represent on an ECG? Ventricular depolarization, atrial depolarization, atrial repolarization, ventricular repolarization. The P wave shows the electrical impulse traveling through the atria. Question 2. What is the normal duration of a PR interval? 0.06 to 0.10 seconds, 0.12 to 0.20 seconds, 0.20 to 0.30 seconds, less than 0.04 seconds. A normal PR interval ranges from 0.12 to 0.20 seconds, 3 to 5 small boxes. Question 3. The QRS complex represents atrial contraction, ventricular depolarization, ventricular relaxation, SA node firing. The QRS complex indicates the electrical activation of the ventricles. Question 4. A heart rate of less than 60 beats per minute is called tachycardia, bradycardia, sinus rhythm, arrhythmia. Bradycardia is defined as a heart rate slower than 60 bpm. Question 5. Where is the V1 lead placed? Fourth intercostal space, right sternal border. Fourth intercostal space, left sternal border. Fifth intercostal space, midclavicular line, left midaxillary line. V1 is positioned at the fourth ICS to the right of the sternum. Question 6. Which rhythm is characterized by a sawtooth pattern? Atrial fibrillation, atrial flutter, ventricular tachycardia, first-degree AV block. Atrial flutter typically shows characteristic F waves in a sawtooth pattern. Question 7. The T wave on an ECG represents atrial depolarization, ventricular depolarization, ventricular repolarization, atrial repolarization. The T wave indicates the ventricles are resetting electrically. Question 8. In a standard ECG, how much time does one small square represent? 0.01 seconds, 0.04 seconds, 0.10 seconds, 0.20 seconds. Each small 1 mm box equals 0.04 seconds at standard paper speed. Question 9. A widened QRS complex, greater than 0.12 s, often indicates atrial enlargement, bundle branch block, sinus bradycardia, normal conduction. A wide QRS suggests a delay in ventricular conduction, such as a bundle branch block. Question 10. Which lead is considered a rhythm strip most commonly? Lead I, lead 2, lead 3, AVR. Lead 2 is most commonly used for monitoring rhythm as it follows the heart's electrical axis. Question 11. What is the primary pacemaker of the heart? AV node, bundle of His, Purkinje fibers, SA node. The sinoatrial, SA, node normally initiates the electrical impulse. Question 12. ST segment elevation is a classic sign of old myocardial infarction, acute myocardial infarction, STEMI, hypokalemia, sinus arrhythmia. ST elevation often indicates acute injury to the heart muscle. Question 13. A PR interval longer than 0.20 seconds with a QRS following every P wave is first-degree AV block, second-degree type I, second-degree type 2, third-degree block. First-degree block is defined by a consistent delay in AV conduction. Question 14. Atrial fibrillation is best described as regularly irregular, irregularly irregular, perfectly regular, bradycardic. AFib is characterized by the absence of P waves and an irregular ventricular response. Question 15. Where should the V4 electrode be placed? 4th ICS, left sternal border. 5th ICS, left midclavicular line. 5th ICS, anterior axillary line. Midway between V2 and V4. V4 is placed in the 5th intercostal space at the midclavicular line. Question 16. What is the standard paper speed for an ECG? 10 mm per second, 25 mm per second, 50 mm per second, 100 mm per second. 25 mm per second is the standard recording speed. Question 17. Which electrolyte imbalance is most commonly associated with tall, peaked T waves? Hypocalcemia, hyperkalemia, hyponatremia, hypomagnesemia. Hyperkalemia, high potassium, causes tall, symmetrical, peaked T waves. Question 18. The vertical axis of ECG paper measures time, voltage/amplitude, heart rate, resistance. The vertical squares measure the strength of the electrical signal in millivolts. Question 19. What does an inverted P wave in lead 2 usually indicate? Normal sinus rhythm. The impulse is originating from the AV junction or low in the atria. Lead reversal. Ventricular hypertrophy. Inverted P waves in lead 2 suggest the impulse is traveling away from the positive electrode. Question 20. Ventricular fibrillation, VFib, is considered a benign finding, a cardiac emergency requiring immediate defibrillation, a normal variant in athletes, easily treated with aspirin. VFib is a life-threatening rhythm where the heart quivers and cannot pump blood.